Introduction. Dr. Leslie Kernison is a board-certified geriatrician and the founder of the website betterhealthwhileaging.net. She is also the host of the video podcast Better Health While Aging, a program dedicated to discussing common health issues affecting adults over the age of 60, along with practical strategies for prevention and effective management. The show frequently addresses very real, everyday concerns in elder care, especially when families worry about fall risks, home safety, memory decline, or the overall quality of medical care their loved ones are receiving. In this episode, Dr. Kernison focuses on vitamin B12 deficiency, a nutritional issue that is common among older adults, yet often overlooked in routine medical care. She emphasizes that this condition deserves attention because it occurs frequently and the risk increases with age. A lack of vitamin B12 can have a significant impact on the body, particularly on blood formation and the nervous system, which in turn can affect overall health and quality of life. Before diving into the main content, she invites viewers to subscribe to the channel to support the program and help make these valuable health insights accessible to a wider audience. She also notes that a detailed companion article is available on Better Health While Aging, allowing viewers to review all the key points in full without the need to take extensive notes. 2. Why vitamin B12 deficiency matters. Vitamin B12 deficiency is a significant health concern in older adults, first and foremost because of how common it is. Research shows that the prevalence of vitamin B12 deficiency in older populations varies widely from about 3% in some groups to nearly 40% in those at higher risk. In other words, within the aging population, this is not a rare condition at all. It occurs far more often than most people realize. The second reason vitamin B12 deficiency is especially important lies in the critical role this vitamin plays in the body. Vitamin B12 is essential for healthy red blood cell production. When deficiency persists over time, it can lead to anemia, resulting in fatigue, reduced stamina, shortness of breath, and a noticeable decline in day-to-day functioning. Beyond that, vitamin B12 is vital for the nervous system. A deficiency can damage nerves, worsen problems with memory and thinking, and make it harder to maintain balance and walk safely. Another major concern is that vitamin B12 deficiency is frequently overlooked in routine medical care, particularly in older adults. Its symptoms are often nonspecific, develop slowly, and are easily dismissed as just part of aging. As a result, many people are never diagnosed or treated in a timely manner, despite the fact that this is a condition that can be identified relatively easily and treated safely and effectively. For all of these reasons, increasing awareness of vitamin B12 deficiency is crucial. It empowers older adults and their families to be more proactive about monitoring health and communicating with healthcare providers, helping to avoid missing a treatable cause behind many common and often disabling health problems. Comment has shown. This is a clear example of why not every health problem in older adults should be automatically labeled as normal aging. Comment #0. Vitamin B12 deficiency is one of the few conditions that is common, easy to test for, and has a well-established treatment pathway if it is caught early. 3. What is vitamin B12 and what does it do in the body? Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an essential role in many of the body's most critical biological processes. One of its primary functions is its involvement in DNA synthesis and cell division. Tissues with a high rate of cell turnover, most notably the bone marrow, where red blood cells and other blood cells are produced, depend heavily on an adequate supply of vitamin B12 to function properly. In addition to its role in blood formation, vitamin B12 is especially important for the nervous system. It helps maintain the health and function of peripheral nerves, which are responsible for transmitting sensory and motor signals, and it also supports the central nervous system, including the brain. When vitamin B12 levels are low, nerve cells can be damaged, leading to problems with sensation, movement, memory, and cognitive function. Many of vitamin B12's biological functions are closely linked with folate, vitamin B9. These two vitamins work together in key metabolic pathways throughout the body. However, while folate deficiency has become less common due to widespread food fortification, vitamin B12 deficiency remains relatively frequent, particularly among older adults. In summary, although vitamin B12 is required only in very small daily amounts, its impact on blood production, nervous system function, and overall health is substantial. Ensuring adequate vitamin B12 intake is therefore crucial for maintaining health and quality of life, especially as people age. 4. Sources of vitamin B12 and daily requirements. Vitamin B12 is unique in that it is found almost exclusively in foods of animal origin and is essentially absent from natural plant-based foods. Rich dietary sources include red meat, poultry, fish, seafood, eggs, and dairy products. With a diet that regularly includes these foods, most adults are able to meet their daily vitamin B12 requirements without difficulty. For individuals who follow a vegetarian diet, especially those who are strictly vegan, the risk of vitamin B12 deficiency is higher unless supplementation is intentional. Although vitamin B12 does not naturally occur in plant foods, some vegetarian products, such as breakfast cereals or plant-based milks, are fortified with vitamin B12 during processing. However, the amount added may not always be sufficient, and not all products are fortified, making consistent intake less reliable. The body's daily requirement for vitamin B12 is actually quite small. The average recommended intake for adults is approximately 2.4 micrograms per day. In addition to dietary sources, many people obtain vitamin B12 through multivitamin supplements, which often contain amounts well above the daily requirement to ensure adequate absorption. An important point to note is that the body is capable of storing vitamin B12, primarily in the liver and, to a lesser extent, in other tissues. Because of these reserves, even if vitamin B12 absorption is disrupted, the body can often continue functioning normally for a relatively long period, commonly up to about a year before deficiency symptoms appear. This storage capacity helps explain why vitamin B12 deficiency tends to develop slowly and can be difficult to recognize in its early stages, particularly in older adults. 5. How vitamin B12 is absorbed and processed in the body. For vitamin B12 to be used effectively by the body, it must go through a relatively complex process of digestion, absorption, and transport. After vitamin B12 is consumed either through food or supplements, it first needs to be released from the proteins to which it is bound in food. This initial step depends on adequate stomach acid and digestive enzymes in the stomach and small intestine. A critical component of vitamin B12 absorption is intrinsic factor, a protein produced by specialized cells in the stomach lining. Once vitamin B12 has been freed and processed in the early stages of digestion, it binds to intrinsic factor. This vitamin B12 intrinsic factor complex then travels to the small intestine, where vitamin B12 can be efficiently absorbed into the bloodstream. If the body does not produce enough intrinsic factor, vitamin B12 absorption is significantly impaired. In this situation, even a diet that provides sufficient vitamin B12 may fail to meet the body's needs because absorption is inadequate. The body does retain a passive absorption pathway that does not require intrinsic factor, but this route is extremely inefficient, typically allowing only about 1% or even less of ingested vitamin B12 to be absorbed. Once absorbed, vitamin B12 is transported through the bloodstream and stored primarily in the liver, while also being utilized in essential metabolic processes throughout the body. Because absorption depends so heavily on proper stomach and intestinal function, any condition that affects these organs can reduce vitamin B12 absorption, a problem that is particularly common in older adults. 6. Why older adults are more prone to vitamin B12 deficiency. As people age, a range of physiological changes and chronic health conditions can reduce the body's ability to absorb vitamin B12. One of the most common reasons is a decline in stomach acid production. This can occur as part of age-related gastric atrophy or as a result of long-term use of acid-suppressing medications, such as those prescribed for acid reflux or gastroesophageal reflux disease, GERD. When stomach acid levels are low, vitamin B12 cannot be efficiently released from food, which interferes with proper absorption. In addition, several medications commonly used by older adults can affect vitamin B12 absorption. A notable example is metformin, a widely prescribed and often long-term treatment for type 2 diabetes. While metformin has clear benefits and should not be discontinued without medical guidance, prolonged use has been associated with lower vitamin B12 levels if not appropriately monitored. Other factors that increase the risk of vitamin B12 deficiency in older adults include excessive alcohol consumption, which can damage the stomach lining, a history of stomach or intestinal surgery, and conditions that impair nutrient absorption, such as Crohn's disease or celiac disease. Long-term vegetarian or vegan diets without adequate vitamin B12 supplementation also place individuals in a higher risk category. Because many of these factors accumulate over time, the ability of older adults to absorb vitamin B12 often declines gradually. As a result, vitamin B12 deficiency becomes common in this age group even when overall dietary intake appears to be adequate. Comment has shown. In older adults, vitamin B12 deficiency is usually not caused by poor dietary intake, but rather by problems with absorption. Comment #0. Understanding these risk factors makes it easier to detect vitamin B12 deficiency early and to take effective preventive measures. 7. Symptoms of vitamin B12 deficiency. The symptoms of vitamin B12 deficiency primarily involve two critical body systems, the blood-forming system and the nervous system. These are the areas most affected when vitamin B12 is lacking. Importantly, symptoms often develop gradually, progress quietly, and are easily mistaken for other age-related health problems in older adults. From a hematologic perspective, vitamin B12 deficiency can lead to anemia because the body is unable to produce red blood cells normally. This type of anemia is typically characterized by abnormally large red blood cells. When anemia is present, individuals may experience persistent fatigue, weakness, dizziness, or shortness of breath with exertion. However, it is important to note that vitamin B12 deficiency does not always present with obvious anemia. Neurologically, vitamin B12 deficiency can cause peripheral neuropathy. Individuals may notice numbness, tingling, burning sensations, or reduced sensation in the hands and feet. As the condition progresses, it can interfere with balance and walking, significantly increasing the risk of falls in older adults. Vitamin B12 deficiency can also affect cognitive function. People may experience memory problems, reduced concentration, slower information processing, or impaired executive function. In some cases, these changes may present as increased irritability, personality changes, or emotional instability. Notably, neurological and cognitive symptoms can appear even before anemia is detected, making diagnosis more challenging unless vitamin B12 deficiency is actively considered. 8. Pernicious anemia and its relationship to vitamin B12. Pernicious anemia is a specific and clinically important form of vitamin B12 deficiency, particularly in older adults. Unlike vitamin B12 deficiency caused by inadequate dietary intake, pernicious anemia results from an autoimmune condition that affects the stomach lining. In pernicious anemia, the immune system attacks and destroys the stomach cells responsible for producing intrinsic factor, the protein that is essential for vitamin B12 absorption in the small intestine. Without intrinsic factor, the body is essentially unable to absorb vitamin B12 through the normal digestive pathway, even when dietary intake is adequate. This condition is estimated to affect approximately 2% of older adults. An important point to understand is that the term pernicious anemia can be misleading. Not everyone with this condition develops anemia at the outset. In some cases, vitamin B12 levels decline, and neurological or cognitive symptoms appear before anemia is detectable on blood tests. This can make diagnosis more challenging if clinicians focus solely on the presence or absence of anemia. Because pernicious anemia represents a chronic and ongoing cause of vitamin B12 deficiency, individuals with this condition typically require long-term, often lifelong, vitamin B12 supplementation. Correctly identifying the underlying cause allows clinicians to select the most appropriate treatment approach and monitor effectiveness over time, while also helping patients understand why sustained therapy is necessary. 9. Why vitamin B12 deficiency is often overlooked. Vitamin B12 deficiency is frequently missed in clinical practice, especially among older adults, despite its high prevalence and potentially serious consequences. The primary reason is that its symptoms are highly nonspecific and overlap with many other health problems that are common in later life. Symptoms such as fatigue, memory decline, slowed walking, poor balance, numbness or tingling in the hands and feet, and anemia are all common in older adults and are often multifactorial. In many cases, these signs are quickly attributed to normal aging or explained by other chronic conditions the individual already has. As a result, neither clinicians nor patients may consider vitamin B12 deficiency as a potentially reversible underlying cause. Another factor contributing to underdiagnosis is the slow and insidious course of the condition. Vitamin B12 deficiency typically develops gradually over months or even years. Subtle changes may go unnoticed by both patients and healthcare providers, leading to delays in testing and diagnosis. In addition, in everyday clinical practice, when vitamin B12 test results fall into a low normal range, further confirmatory testing, such as measuring methylmalonic acid, is often not pursued. This can result in clinically meaningful vitamin B12 deficiency being missed. Likewise, the absence of overt anemia may reduce the likelihood that vitamin B12 levels are checked, even though neurological damage or cognitive decline may already be present. Taken together, the combination of nonspecific symptoms, slow progression, and incomplete diagnostic evaluation makes vitamin B12 deficiency an easy condition to overlook in older adults. 10. Who should be tested for vitamin B12 deficiency? Not everyone needs routine vitamin B12 testing. However, there are specific groups for whom testing is particularly important, especially given the higher risk of deficiency in older adults. Identifying the right individuals to test allows for early detection and timely intervention, helping to prevent avoidable complications. First, older adults who present with symptoms suggestive of vitamin B12 deficiency should be tested. These symptoms include persistent fatigue, unexplained anemia, numbness or reduced sensation in the hands and feet, difficulty with walking or balance, as well as problems with memory, thinking, or concentration. In geriatric practice, vitamin B12 testing is often part of the standard evaluation when assessing cognitive decline or gait disturbances. In addition to symptoms, individuals with known risk factors should also have their vitamin B12 levels checked, even if they do not yet have obvious clinical signs. Common risk factors include long-term use of metformin or acid-suppressing medications, a history of gastrointestinal disease or malabsorption disorders, heavy alcohol use, and prolonged adherence to vegetarian or vegan diets without adequate vitamin B12 supplementation. One critical point to emphasize is that the absence of anemia does not rule out vitamin B12 deficiency. A person can have low vitamin B12 levels and already be experiencing neurological or cognitive symptoms before anemia develops. Therefore, when appropriate symptoms or risk factors are present, testing for vitamin B12 is both reasonable and necessary rather than waiting until more severe or irreversible manifestations appear. 11. How vitamin B12 deficiency is diagnosed. Diagnosing vitamin B12 deficiency is relatively straightforward and relies primarily on blood testing. The first step is usually to measure the serum vitamin B12 level, a common and widely available test. In general, vitamin B12 levels are considered normal at approximately 300 picograms per milliliter, pg/ml or higher. When levels are clearly low, particularly below 200 pg/ml, a diagnosis of vitamin B12 deficiency can be made and treatment initiated. In clinical practice, however, many individuals have vitamin B12 levels that fall into a borderline or low normal range, typically between 200 and 400 pg/ml. In these cases, serum vitamin B12 alone is insufficient to draw a firm conclusion. A confirmatory test, methylmalonic acid, MMA, is then often used. Vitamin B12 is required for the metabolism of MMA. When vitamin B12 is deficient, MMA accumulates and blood levels rise. An elevated MMA therefore indicates clinically significant vitamin B12 deficiency, even when serum B12 levels are not markedly low. Depending on the clinical context, physicians may also order additional tests to identify the underlying cause of vitamin B12 deficiency, such as evaluations for pernicious anemia or gastrointestinal malabsorption disorders. A complete blood count is often included to assess for anemia, although it is important to remember that vitamin B12 deficiency can still be present even when blood counts are within the normal range. Comment has shown. Assessment of vitamin B12 status should not rely on a single number alone, but must be interpreted in the context of symptoms and supporting laboratory findings. Comment #0. Measuring methylmalonic acid plays a key role in avoiding misdiagnoses of underlying or early vitamin B12 deficiency. 12. Treatment of vitamin B12 deficiency. The treatment of vitamin B12 deficiency is generally straightforward, safe, and highly effective. The core principle is to replenish vitamin B12 levels to the normal range in order to prevent further damage and to improve or reverse symptoms. Vitamin B12 can be supplemented using both prescription and over-the-counter formulations, and in most cases, treatment yields excellent results. A commonly used therapeutic dose is 1,000 micrograms of vitamin B12. Vitamin B12 can be administered through two primary routes: daily oral supplementation or intramuscular injection. It is not given intravenously. One major advantage of vitamin B12 therapy is its strong safety profile. The body does not significantly accumulate excess vitamin B12, as any surplus is excreted in the urine, making the risk of overdose extremely low. Historically, vitamin B12 injections were considered the standard treatment. However, more recent research has demonstrated that high-dose oral vitamin B12, typically 1,000 to 2,000 micrograms per day, is just as effective as intramuscular injections in treating vitamin B12 deficiency, including in cases of pernicious anemia. This works because even though passive absorption is limited, large oral doses still allow enough vitamin B12 to be absorbed to meet the body's needs. The choice between oral and injectable vitamin B12 depends on several factors, including the severity of the deficiency, the extent of symptoms, and the individual's ability to adhere to treatment. For patients who can reliably take a daily supplement, oral therapy is often more convenient and less invasive. In contrast, intramuscular injections may be preferred when rapid correction is needed or when consistent daily oral intake is difficult to maintain. 13. Treatment response timeline and follow-up for vitamin B12 deficiency. After treatment for vitamin B12 deficiency is initiated, blood levels of vitamin B12 typically rise quite rapidly, especially when therapeutic doses are used. With either high-dose oral supplementation or intramuscular injections, a clear improvement in serum vitamin B12 levels can often be seen within 2 to 4 weeks. For this reason, repeat testing after this interval is frequently useful to assess the response to treatment. From a hematologic standpoint, the bone marrow usually responds early to vitamin B12 replacement. In individuals with adequately functioning bone marrow, signs of improved red blood cell production can appear within 1 to 2 weeks. If anemia is present, it often improves substantially and may normalize within 1 to 2 months, depending on the severity of the initial deficiency. In contrast, neurological symptoms tend to recover more slowly. Nerve damage caused by vitamin B12 deficiency requires time to heal, and noticeable improvement often takes several months. In some cases, recovery may continue for up to a year. If the deficiency has been present for a prolonged period, some degree of neurological damage may be incomplete or irreversible. Regarding the duration of therapy, many older adults require long-term, sometimes lifelong, vitamin B12 supplementation, particularly when the underlying cause is chronic malabsorption. Once vitamin B12 levels and body stores have been restored, some patients can transition from intramuscular injections to oral supplementation with ongoing periodic monitoring to ensure that vitamin B12 levels remain stable. 14. Preventing vitamin B12 deficiency. Vitamin B12 deficiency is largely preventable, particularly in individuals who are at higher risk. The most effective preventive strategy follows the same basic principle as treatment, ensuring a consistent and adequate supply of vitamin B12 through diet and, when necessary, supplementation. For older adults with risk factors such as impaired gastrointestinal absorption, long-term use of metformin or acid-suppressing medications, heavy alcohol consumption, or adherence to vegetarian or vegan diets, daily vitamin B12 supplementation is a simple and safe preventive measure. A commonly recommended preventive dose is approximately 1,000 micrograms per day, which is sufficient to compensate for reduced absorption and help maintain stable vitamin B12 levels. Vitamin B12 can be taken in several forms, including standard oral tablets, sublingual lozenges, or as part of a multivitamin preparation. Many effective options are available without a prescription. Using a high-quality multivitamin may offer additional benefits, as it provides not only vitamin B12, but also other B vitamins that support metabolic function and overall health. Most importantly, preventing vitamin B12 deficiency is easy to implement, low in cost, and associated with minimal risk. Compared with many other health issues affecting older adults, this is a straightforward intervention that can meaningfully reduce the risk of anemia, neurological complications, and cognitive decline, thereby helping to preserve quality of life and long-term independence. 15. Conclusion. Key takeaways on vitamin B12 deficiency. Vitamin B12 deficiency is a very common condition in older adults, and its prevalence increases with age, primarily due to a gradual decline in the body's ability to absorb this nutrient. Although vitamin B12 is required only in very small daily amounts, it plays a critical role in blood formation and in maintaining healthy nervous system function. As a result, deficiency can directly affect physical health, memory, mobility, and overall quality of life. The symptoms of vitamin B12 deficiency are often nonspecific, develop slowly, and are easily mistaken for what is considered normal aging. Fatigue, memory decline, gait disturbances, and numbness or tingling in the hands and feet are frequently overlooked or attributed to age-related changes. Importantly, the absence of obvious anemia does not rule out vitamin B12 deficiency. Older adults who have suggestive symptoms or known risk factors such as long-term use of metformin or acid-suppressing medications, gastrointestinal disorders, heavy alcohol use, or vegetarian diets should be tested for vitamin B12 in a timely manner. Diagnosis is relatively simple, and treatment with vitamin B12 supplementation is safe, effective, and inexpensive. Perhaps most importantly, vitamin B12 deficiency is one of the few common health problems in older adults that can be readily identified and successfully treated. Raising awareness of this condition empowers older individuals and their families to take a more proactive role in healthcare discussions, reduces the risk of misdiagnoses, and helps preserve health, independence, and quality of life over the long term.